Yeah, so thank you for the introduction. Yeah, so my name is Ben Matthews. Like you said, I'm the clinical lead physio in what is now the Prehab and Optimisation service in Hywel Dda University Health Board. So within our service, Catherine Davis is also on the call today. She's our clinical lead occupational therapist, and we have two kind of dietitians in the team. They're not here with us today. We also got two therapy support workers and a member within the admin team. So just a bit of a kind of background to our service. So in 2021, the end of 21, we were the Orthopaedic Prehab and Optimisation service. So the main reason for kind of this introduction was due to the pandemic's impact on planned waiting lists for hip and knee replacements. It was funded by the Welsh Government, and due to the impact of the pandemic of COVID, and because of the large geographical area of Hywel Dda, the idea was that we were able to target more people and standardise the care that we give by adopting a virtual service model. So we adopt a holistic kind of MDT approach, as you can see from the professions involved. And the scale of the problem we had was that there were over 4,000 patients awaiting hip and knee replacements within our health board. So with regards to its delivery, our service, so we had kind of three tiers or options in how we wanted to support these patients. So tier one, which we'll talk a bit more in detail kind of later on, was our 8-week prehab program, which we put on PKB. Tier 2 is our live virtual group prehab supported by technology-enabled care and digital monitoring, and that's kind of 12 sessions over a 12-week period. And we also have virtual one-to-one sessions then for patients with more complex care needs or aren't suitable for the groups. So more about our PKB offer. So back in, like we said, end of 21, beginning of 22, due to the number of patients we had awaiting hip and knee surgery in the health board, and there was no offer or previous offer of prehabilitation or support for these patients. Historically, patients were listed for surgery and were waiting on the waiting list. Pre-assessment would phone them, they would come in for pre-assessment, and then they were deemed either fit or unfit for surgery. A lot unfit for surgery had to go back to the GP to maybe manage their health conditions, their BMI. So we know we needed some support or some intervention in that kind of interim period. So PKB offered a digital solution to provide an offer to these patients. Therefore, we started the service. When we started the service, our first aim was to develop our PKB channel. So once we did develop it, we did a mass registration process, which involved sending patients letters on the waiting list with QR codes and links to link them directly to register to PKB and access our 8-week care plan and the resources that were on the channel. So we use PKB as a platform to deliver an 8-week care plan to guide patients through a prehab and optimisation program, which includes videos on education, exercise, and different components of prehab. The care plan guides patients through an 8-week program. Each week focuses on a specific element of prehab, such as healthy eating, managing osteoarthritis, medical optimisation, managing day-to-day activities. And then each week has an exercise video for them to follow that week. The content was designed by the MDT team, and we also used behaviour change and health promotion language throughout the scripts in order to engage and motivate the patients. We also invited patients to complete self-questionnaires at some weeks within the care plan to help patients monitor and reflect on their own progress. And when we started, due to the high volumes of patients and the lack of clinical staff that we had, we chose to initially switch off the message function on the platform. However, this has now been kind of turned on, and messages are being supported, being monitored, not with us, but with the waiting list support team then, and they can kind of contact us if need be. We also use the library function to upload relevant and useful resources for the patients to access. These resources were chosen by the clinical team and are evidence-based. And prior to this, they weren't available or provided to patients. The library also ensures the resources are all in one place and easy to access. And our aim by using PKB is to promote the patient to manage their own health and well-being in preparation for their surgery. So other ways in which we sign patients up. So we said about the mass registration right at the start. We assess patients who are due to come in for surgery. We try and time it right over the next kind of 6 months that they're due to come in for surgery. And we also get patients referred to us who are in need of our support and input. From our assessment, as we mentioned earlier, we have three tiers in how we can support patients. We sometimes sign up patients directly from our assessments and explain to them how to use it, and we provide them with our contact number or waiting list support number if they need kind of further assistance. So from our experience, this sign up process is a lot more engaging to patients. So that's something we have learned. And does have improved compliance with that 8-week care plan. We also sign up patients who have been through our virtual and interactive 12-week program. So people who are still awaiting surgery following completion of that group. So we give them access to PKB so they can continue with the good work that they've done over the 12 weeks. So they can use the exercises and use the resources, and patients have found this useful. Patients who also contact our waiting list support service who are deemed suitable for the PKB offer are also signed up by them, and again they show them how to navigate the platform and how to use it. So some stats. So we've got 576 patients registered. We had a big spike in registrations at the start of 22 due to the mass kind of registration that we did. Looking at recent registrations, we are learning that more time needs to be spent guiding the patient to access it and explaining clearly to them how we want them to use it. So when like we said, when we are doing the assessment and signing them up, taking a little bit of time explaining to them how we actually want them to use it and what it's there for does help then for patients to engage. There's a graph of kind of the active users. 83 active users in June. Some patient feedback. They found it easy to access, and it does fit in with patients who are still working a full-time job, so they can fit in accessing the channel when they can, and they found the information and the exercises quite beneficial to prepare for their surgery. So some of the learnings, I think I've mentioned some of them before. So signing up following assessment equals better engagement. So spending a little bit of time to clearly outline why and how you want the patient to use it does help. Our partnership with PKB and waiting list support team has been essential in kind of setting it all up. Our clinical team has bought into kind of the virtual and the digital kind of delivery kind of model, and that's been very important. We've kind of learned that if a patient is more digital competent, again, that equals a better kind of compliance to following the care plan or PKB. There's been positive patient and staff experience. Age is definitely not a barrier. There's been patients, from the age of 40 to 80 to 90, accessing our kind of PKB channels. And we also try and get kind of family and friends support with patients, how they can kind of use PKB. And kind of moving on, we are, we're now known as the Prehab and Optimisation service, because we've now rolled our kind of offer of prehab and optimisation to other surgeries. So we've recently started assessing gynae patients, and we will move on to kind of general surgery patients. So we are in the process of developing a PKB offer for these patients. So we've started populating the library resources. We've done some filmed some exercise videos. We've done some new education and advice videos, again, to populate the 8-week care plan for these different surgeries, then, to offer them prehab and optimisation. Thank you very much.
Thank you, Ben. That was a great presentation. And again, I think such a powerful use of PKB